Thank you so much. Okay, I'm always slow at the uptick on this kind of stuff, so I apologize. But anyway, I'm really excited to be here because I have practiced medicine for 30 years and in an integrative way. Very quickly out of residency, I found that most people that were coming in for anything, whether it's a sore throat or fatigue or chest pain, I felt like I had zero things in my toolkit. I was putting people on medications, and those medications were causing side effects. And even if I was talking about therapy or physical therapy or social, psychological therapy, it felt like something was really missing. And we don't get taught the power of lifestyle. At least we didn't when I was training 30 years ago. And as my career progressed and as I discovered something like acupuncture, which was very holistic minded within a few years of my practice, I started the practice of acupuncture, changed my whole outlook on healing versus putting out fires. And what I really want to emphasize is the amount of control people have in their future destiny of health because they have so much power of the choices that they make that are lifestyle. So most of this lecture really is about empowering people to understanding how much control they really do have in spite of their genes, in spite of their environment, in spite of the pollution and the soil issue. But if we can capture the power of lifestyle, we can really, really change and push forward healthy aging. So what I want people to kind of think about is, why is chronic illness coming up so much? Why do we have such an epidemic of different chronic infections, chronic illnesses like heart disease and diabetes and autoimmune disease, neurodegenerative disease? What is going on? Why is this happening? And what is their connection to environmental issues? What is the connection to stress, our own stress, our thoughts, our fears? And how can we manipulate this? What are the early signs? And what is it that I control versus I have to go to a doctor's appointment? Now, this is not saying that you should not see a doctor. This is not saying that you shouldn't have a provider. This is just about talking about the role of what you can do as an individual. And it's very, very empowering. So when I learned all of these through the course of the last 20 some years outside of residency and medical school, I really am so excited about it and passionate about it. I want to scream it from the rooftop, which is why we also wrote our book, to try to empower people. But having a step back, I want us to talk about, when you listen to my talk, think really deeply on, why did you sign into this lecture? What is your why? What are you looking for? And it's not necessarily, I have hypertension, I have diabetes. It could also be things like, why am I so tired? And why do I have so much pain in the morning? Why am I gaining so much weight? And my sport performance isn't as good. I'm not doing as much as well as I was on timing. I take longer to recover. What about my genes? My mom had pancreatic cancer. What does that mean for me? And feeling like you're just aging faster. I have Hopkins in my backyard, and a lot of my patients come after seeing very smart doctors who are very well trained, but they get told things like, well, what do you expect? You're getting older. That is never a good answer for me. I'm never satisfied with that answer, because the physiology of how we age and how we break down is very personal and very unique to someone's genes, someone's gut microbiome, someone's lifestyle choices. So we really want to tease out what is in our control and what is not in our control. And maybe something is just, I just want to learn more. I want to educate my family. I want to help other people. And that's fantastic. So just think about, what is your why, because I'm going to come to it at the end of the lecture. So as I said before, it's an epidemic of chronic illness. We are having much more cardiac issues, many more cancers, and earlier onset, a lot more autoimmune disease, metabolic issues like diabetes, neurodegenerative like Alzheimer's and Parkinson's, and movement disorders. And it's really, really scary as a concept, because our genes haven't changed. So what is going on? Is it our soil? Is it our water? Is it our stress? What is happening that we actually have control over? So the other issue is also, it's not just limited to adults. Even in children, we're getting earlier metabolic issues, diabetes, not even type 1, which people are born with. They have a genetic predisposition. Sometimes their pancreas doesn't work. Sometimes it happens after a viral infection. But we're seeing type 2 diabetes, which is the type that really is associated with obesity. We're seeing an epidemic of obesity in children. We're seeing shingles, which used to be a function and an illness of elderly. When I was first starting to train, it was something we saw in 65 years and older because of your immune system. What happens is you get the chickenpox virus and it hibernates within us. And then when your stress levels go high, it starts to break out, and the breakout is called shingles. And that is happening not just at 65, it's happening at 50, at 30, at 35. We've just changed the recommendations for getting people shingles vaccine at 50. And I have people in their 40s getting shingles. So it is just the concept of what is going on with our immune system. And all of this is tied in to our immune system, which I'll expand about later in this lecture. Currently, when I first started practicing medicine, this was why I was frustrated, because I felt like I had very little tools for my patients to feel well. I had medications, which I use today. I have supplements. I have, referral for surgery. I have rehabilitation. We have injections. We have procedures that you can do under anesthesia. You have procedures you can do under, integrative radiologist. We also have therapies. We have therapies, physical therapies. We have psychological therapies, and everything has a role. But what is not discussed enough is the role of lifestyle choices. And that is, I believe, one of the most powerful tools we have in combating inflammation. Currently, the model for medicine in most traditional practices is whack-a-mole, which is you wait for symptoms, you wait for an illness to happen, and then you whack it, and then you treat it. And then you have side effects sometimes from the medications that you're treating. And polypharmacy is a really big problem as we age. What that means is that we're using more and more medications combined with different side effects, and sometimes their interactions aren't great. So they're not getting metabolized. So then you're building up metabolites of the medications. So a bigger concept would be to understand, why am I getting this illness? Because one intervention in a lifestyle pathway, unlike a drug, which only really works on one singular pathway and typically only for one illness. And because we have multiple illnesses as we get older, hypertension, diabetes, heart disease, history of stroke, maybe some movement disorder, all of those will require different medications. But sometimes when we employ lifestyle techniques, we can knock out so many of those, because the root cause of inflammation is what ties a lot of them together. And inflammation is 80% focused in our gut. And that is what we're going to spend a lot of time on today, talking about our gut. But really what the connection of everything is inflammation. And those cells which make inflammation are our immune system. And these are white cells, they're cytokines, there's different words for them. We heard a lot about it with COVID. But really what the issue is that our body is telling us that there is a danger and we have to pay attention. We're currently practicing sick medicine versus well medicine. And well medicine is even when you feel well, even when you're not having an ache or a rash or a headache, you're thinking about, how do I keep my body in balance? What are the things that I can do to kind of maintain homeostasis, which is a balanced state for my body, so that I don't give it enough room to break down? And what we are doing most of the time is we're not paying attention to what our body's telling us. We are seeing signs and symptoms all the time. Some of those questions I asked in the beginning, which was, why do I not recover from my workouts as fast? Why am I gaining weight in the midsection? Why do I feel so tired in the afternoon? And it is not most of the time because you're older. It is not because you're 40 or 50 or 60. It is because your body is out of balance. And many, many of our current treatments also have side effects. So the side effects of the medication. So for example, you go to your doctor, you have knee pain. And the knee pain, you get on ibuprofen, which is Motrin. There's prescription strength for that. You keep taking that and you have a stomach issue because ibuprofen breaks down the gut. So then you get put on Prilosec, which is an acid blocker. And then Prilosec has a side effect, which could cause a kidney dysfunction, or it could raise your blood pressure. And then now you have to go on a blood pressure medicine. So as you can see, some of this is just kind of one after the other breakdown, and not really addressing, well, maybe it's because I sit too much and I've gained 10 pounds and my knees feel bad. So maybe the answer is not just taking Motrin, but also maybe I need to move more. Maybe I need to stretch more. Maybe I need to go on, do some physical therapy. Maybe I just need to walk. So again, just kind of thinking big picture, keep thinking about lifestyle. One concept I want to bring up, outside of just, whack-a-mole, which is wait for something to break and then deal with it. The opposite of that would be to kind of create resilience in your body so that we age gracefully. So we're not waiting for things to break down. And the World Health Organization basically has told us that health is not the absence of illness, but physical, mental, and social well-being. So it's not just about physical well-being, but it's mental and it's social and it's spiritual too. So in our longevity data and our studies that are coming about aging, relationships are really important. What you have passion about is really important. And some of you may have watched the Netflix documentary on Blue Zones, which is, I think it's called Centenarians, but it's based on Mr. Butner's, concepts of aging, which was fantastic. That came out in the 1990s. And we are still trying to play catch up with that because there are countries and communities around the world that are aging gracefully, that don't necessarily go to a gym, that don't necessarily have concepts of where they're keeping time every day for doing regimented things, but their actual life is very much about walking in nature, being with they have great relationships, they're eating fresh food, they're walking everywhere, they're carrying their groceries, they're doing things to make their muscles remember, and they're using their normal body concepts to kind of keep living. So another concept that I'm not going to talk about in this lecture, but one thing that we have in this country that's very different than the concepts that were seen in that video, in those documentaries, is loneliness. We're a very private, kind of a lonely community. So bringing relationships back in and making time to create really great relationships, but also prioritizing time to be with people that you care about and you enjoy is really, really important. So, what are our stressors? So, at the end of the day, my conception of what illness is and what is caused by is a series of stressors on the body. And stressors can be things that we control. Stressors can be what we eat, how we eat, when we sleep, how do we move, what do we pay attention to in terms of our thoughts, who do we spend time with, and what do we think about? All of these are very much in our control, and they are very much, when they're not being thoughtful about or intentional about, they can turn into stressors for us. Also, oral hygiene, extremely important. The bacteria in our gut is equally as important as the bacteria in our gut, in our mouth. So oral and hygiene, when I say hygiene, I mean microbiome in the body and in the oral health. And maybe there's things that are out of our control for stressors. Let me just define stressors for a minute as stressors are things that require our body to change. And stressors are not good or bad. They're just things that ask our body to change. So these are particularly not great. These ones that are out of our control. Sometimes we don't get born. We're not born with good genes. We have pollution. We have soil issues. We have environmental pollution, soil pollution, water pollution. We have family stressors. We have work stressors. We have maybe a boss that doesn't understand us. We have caregiving issues where we're taking care of parents and children. And so stress is real, but infections are real, and where we were born. Sometimes it matters where we were born and when we were born in terms of what kind of toxins we were exposed to. So all of these matter, and I'm not minimizing any of these, but really the thing is about trying to figure out what is in our control. So our bodies are very, very attuned to they want to be resilient. They want to stay in balance. So it gives you a lot of clues. And so our balance concept or homeostasis concept is based on the fact that there's a balance between our stresses and our resources. And today we're going to be spending a lot of time on talking about what we can do about these. What are our resources to combat the things that we may not have control about? I'm not in control of the genes that I was born with. I'm not in control of my environment. And I'm not in control most of the time of the pollution in the environment, as well as maybe the soil and where my foods came from. But I am in control of my sleep patterns. I am in control of my thoughts, and I can move more. So these are things to kind of think about conceptually, because these can actually break us down. All of these things in the stress column can break us down, they can create inflammation in our body, and they can lead to illness. So we have the concepts of balance, right? So our body's always in balance, trying to maintain balance. So we have many, many tools outside of the ones I listed earlier, which are medications and surgeries and therapies. We also have the concept of exercise and movement. It's not just about going to the gym. Really is about sitting less. We have yoga, we have clean water, we have meditation, we have plant-based diet, we have restorative sleep. We also have two things that aren't listed in this slide, which is fasting regimens, periods of rest for our gut, as well as our thought and our optimism for hopefulness for the future. We want to be able to create a hopeful environment that we think tomorrow will be better than today. This too shall pass type of an attitude. And science has shown that those kind of interventions actually make a big difference on longevity and aging. So let's get into some of the concepts. Before I do that, I just want to talk about what stress is. So there are, like I said, stress is not bad or good. When they did try to eliminate stress in the lab environment when they took mice and they kept them in stress-free environments, they didn't thrive. In fact, they died. So we need stress to help keep us growing and become resilient and to become more productive. So stress is not a bad thing. It's the amount of stress and it's the type of stress that we're talking about. So short-term stress, whether that's I'm training for a triathlon, I'm applying for a new job, I'm expecting a baby, any of those are things that we're requiring our body to change. But it is a stressor on our body, but it creates survival and immune protection if we can do it the right way. Short-term stress, often also like a cold or a wound, can last from minutes to hours, and it's experienced through different types of immune mediation called the innate and adaptive immune responses. The immune system is very complicated, so I'm not going to spend too much time on the stress response, but I want to just talk about what it does and why it's connected to the inflammation cascade. It works on white cells, which are immune cells in our body that are also loaded in our gut. So this is one of the reasons why we have such a large input when we can do things that make our gut happier, our microbiome happier, because these cells, like the dendritic cells, neutrophils and macrophages, are loaded within our gut, including mast cells. And when these things get activated, when these cells get activated, they start to release chemicals called cytokines. And those are transmitters in the body that ask for more help. So depending on what the insult is, what the immune system is trying to protect, because remember, the immune system is there to protect us from the foreign bodies, from the foreign concepts, the foreign things that it thinks it's going to injure us. It releases cytokines. And cytokines we heard a lot about during COVID. And cytokines can be related to signaling, and they can be good and they can be bad. You can have pro-inflammatory cytokines and you can have inflammatory, anti-inflammatory cytokines. So it really depends on an acute response. An acute stress response it's not bad or good. It takes into account a new threat to our body, and it starts to activate these things, which help the body get rid of the offending agent. When it turns into chronic, when it turns into long stress, hours and days and weeks and months, we can actually start to change that balance of cytokines to a more pro-inflammatory cytokine balance. It starts to change our innate and adaptive immune responses to kind of change the immune system that can result in immune dysfunction, which then can be in three different categories. So an immune dysfunction can look like, I can't fight this virus. I get sick all the time. Why does it take me 3 weeks to get over a cold, and this one gets over it in 5 days? That's a low immune system, and that's a dysfunction that can happen. Another type of immune dysfunction is allergies. So a low threshold for things that our body has seen already, a low threshold for things that are in the environment that we have been growing up with, but all of a sudden now we're intolerant to. It can be food, it can be bugs, it can be tick bites, it can be so many things. It can be something that the immune system is now very angry about, but before was okay with. So the threshold for tolerance can change as we go through a chronic stressor. And the other kind of concept of stress and breakdown is autoimmune. When the body says, I don't like this anymore, this guy, which could be our joints, which could be our eye, which could be our skin, looks like the bad guy. And the immune system says, I'm going to attack that. And that's an autoimmune response. And quite frankly, in one person, they can have all three dysfunctions. So it's not, it's very complicated. So it's basically a change in the cytokines, creating inflammation and a suppression of things that protect us. So when your body's too busy fighting what it thinks is the bad guy, it doesn't have enough ammunition sometimes to fight viruses, bacteria, cancer cells. So this change in this immune response, secondary to a chronic stress response, can really cause a lot of inflammation in the body, a lot of immune dysregulation in the body, and which ultimately can lead to inflammation. And again, every single medical problem in the medical textbooks have a component of inflammation, which translates into itis. An itis of my scalp can be psoriasis. An itis of my eye can be iritis or conjunctivitis. An itis in my brain can be memory loss. It can be anxiety. It can be depression. So as you can see, an itis isn't just sinusitis or bronchitis. It can be any organ can have an inflammation, and it turns into a symptom or a diagnosis. And that leads to a body on fire. So if you ignore those symptoms, if you ignore the why am I so tired? Why am I getting joint pain? Why am I getting so many infections? It will ultimately can turn into an actual diagnosis. But we don't want to wait for that. We want to hit it when before it actually does it. But now the beauty of lifestyle is that even if you have a diagnosis, even if you're on the spectrum of feeling mostly well and you have a diagnosis, anywhere along this path, you can actually make a gigantic intervention with lifestyle. Unlike some medications, when we find Alzheimer's patients currently with the illness, very few drugs right now actually make any impact on that. But in diabetes and heart disease and arthritis, we have lots of meds that make a difference. But what if we combine those meds with lifestyle and started to kind of move the needle back to when we were feeling really well? So this is not a one-way street. This is just the fact that if we ignore those symptoms, we can start to get something like a diagnosis of heart disease, arthritis, or diabetes. So what are these symptoms? Please tell me what I'm missing, right? This is kind of like you're sitting in your car and the engine light is flashing, flashing, flashing. And very few of us, or maybe none of us, would ever just put duct tape on that and just pray and just keep going. But we do that all the time with our bodies. We are constantly ignoring symptoms that our body is telling us. And some of that is, I'm so tired. Why am I tired? And honestly, this was my journey as well. I have begun the journey with integrative medicine, acupuncture, all because when I was getting out of residency, having children, starting my practice, I was always tired, and it was horrible because I had a lot to do in a day. And so I thought I was looking for things that would make me less tired. And I found acupuncture, which is an amazing intervention. But in the journey of finding acupuncture, I also found the role of food, how important digestion was. For me, when I found out how inflammatory certain foods were for me, I was already vegetarian, but as I went to become more plant-based and got rid of dairy, my energy levels went up. As I moved more, my energy levels went up. I could not figure out why, if I sat in traffic, why was I so tired? If I sat in traffic for 2 hours, why was I getting out so tired? I didn't do anything. And so the concept of stress on my body, stress in terms of constantly navigating and sitting all the time, started to kind of, make sense to me that I'm not moving. I'm very stressed out because of this traffic. So my thoughts were creating inflammation in my body. So when you start to tie in these kind of issues with yourself and what you're doing with your lifestyle, it starts to make sense. And when you make the interventions and the symptoms start to change, it's really a home run. So fatigue, digestion, so things that I can't tolerate nuts anymore. Why is that? Why can't I eat corn anymore? I start to feel really uncomfortable.